If you were to line up all the blood vessels in your body, they'd stretch about 95,000 kilometers. Every day, they transport roughly 7,500 liters of blood, though it's actually just the same 4 or 5 liters circulating repeatedly, delivering oxygen and vital nutrients like glucose and amino acids to the body's tissues. That circulating blood pushes against the muscular walls of the vessels. This force is known as blood pressure, which rises and falls with each heartbeat. It's highest during systole, the phase when the heart contracts to push blood through the arteries. This is called systolic pressure. When the heart relaxes between beats, blood pressure drops to its lowest point known as diastolic pressure. In a healthy person, systolic pressure usually ranges between 90 and 120 millimeters of mercury and diastolic pressure between 60 and 80. Together, a typical healthy reading is just under 120 over 80. Blood travels throughout the body's landscape via the vessels of the circulatory system. In any plumbing system, several things can raise pressure on the walls of the pipes: properties of the fluid, extra volume, or narrower pipes. If the blood becomes thicker, it takes more pressure to push it, so the heart must work harder. A high salt diet can do the same. Salt causes the body to retain more water, increasing blood volume and pressure. Stress also plays a role when the fight or flight response is triggered. Hormones like epinephrine and norepinephrine are released, tightening certain vessels, increasing resistance and raising upstream pressure. Most blood vessels can handle these changes. Elastic fibers in their walls help them stay flexible and resilient. But if blood pressure regularly stays above 140 over 90, a condition known as hypertension can become dangerous. The increased strain can cause small tears in artery walls. When the tissue becomes inflamed, immune cells like white blood cells gather at the site. Fats and cholesterol in the blood stick to these spots, gradually building up into a plaque that thickens and stiffens the artery walls. This is called atherosclerosis. If a plaque ruptures, a blood clot can form over the tear, blocking the already narrow passage. If the clot is large enough, it can stop oxygen and nutrients from reaching the tissue downstream. If this happens in the vessels that supply the heart, it can cause a heart attack when cardiac muscle cells die from lack of oxygen. If the clot cuts off blood flow to the brain, it leads to a stroke. Severely clogged arteries can be opened up with a procedure called angioplasty. In this treatment, doctors thread a wire through the vessel to the blocked area, placing a deflated balloon catheter over it. When the balloon inflates, it opens up the passage again. Sometimes a small mesh tube called a stent is inserted to keep the vessel open, allowing blood to flow freely and restore oxygen to the tissues. Staying flexible under constant pressure is a tough job for arteries. The fluid they carry contains substances that can become sticky and clog them. And a healthy heart beats about 70 times, a minute only 2.5 billion times in a lifetime. That sounds like a lot of stress, but don't worry. Your arteries are built to handle the pressure.